Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in the last previous video, we have discussed lots of the important questions on the pediatric respiratory conditions. So, in this today's very important video session, again we are going to discuss a very important questions concept, similar like our last very important session, whereby holding the one particular question, I am explaining all the expected scenario, all the expected practical based questions, all the expected priority based questions, and the very important questions that may strikes from the particular concept. So while explaining, please be involved attentively wherever I am asking the question for the single liner pattern. So you can just try to remember and just try to response in the comment box. Okay. So here in this particular session, you people will get the less questions, more concept, and remember my one word, the concept is the only key for the selection in the Norcet. So I am not only focusing on the questions, I am focusing especially on the concept. By holding one particular question, I will deal every concept that is necessary for your Norcet exam. So believe in me, only concept are going to clear your exam, and concept is the key for the getting the good rank in the mains exam. So I am focusing more over the concept rather than the questions. And wherever I am asking the questions in the form of the multiple choice questions and in the form of the one liner questions, so please be attentively active in the comment box. Okay, keep on commenting. Even someone of you are watching the video after the live session, still you can keep on commenting in the comment box. It is free of cost for every one of you. Okay, no need to pay for anything for that, right? So why? Because you people should actively involve in the class. So that is the my primary concern here. Okay, so let's begin the session here. Okay, with this powerful motivational line, a very good evening to one and all. So I will give my best shot from my side before your exam. So I want every one of you to work hard. Okay, so very good evening, beta. Good evening. Very good evening to one and all. So you once again, I am welcoming you all to the Master Nursing classes. Good evening, beta. Good evening. Very good evening. So please, who all are live to the session, so fataфат share the session with your WhatsApp groups. Okay, and hit the like button and be complete active in the comment box. So that is my personal request to every one of you, right? So consider this one as the personal request, and let's begin the session for our upcoming Norcet selection, right? With this powerful motivational line here. So the line is very simple: stay positive, work hard, make it happen. It is in your hand. Okay, so this is the night, not in time to get relaxed. Yes, you can get relaxed. You have worked 3 hours continually before, means now it is the time to get relaxed for the only 5 minutes. Okay, so yes, you can watch the reels for the 5 minutes and have the self-control. Don't waste the time. It is not a time to watch the reels for the 30 minutes. It is the time to watch the reels for the 3 to 5 minutes. After reading the 3 hours, watch the reels for 3 minutes and again come to the back to your table and read again, because this is the time to work more. So these many days, what you have studied previously, how much you have covered, so that is also going to matter. But now at the end, how you will give the final finish, so that is going to decide your rank. Okay, so yes, very good evening one and all. So please let's start the session without wasting the time. Here is the first question which is coming in front of you all. So please do read the question and give the best answer in the comment box. Yes, the question is here in front of you all. What is the which of the following is not a typical picture of the cystic fibrosis? In the last Norcet, there is the question which was asked on the sweat chloride test from the cystic fibrosis. Question number 1 and the question number 2, scenario based questions. The mummy is kissing to the baby and it is salty. So 2 questions were asked from the cystic fibrosis in the last Norcet. So I want to cover quickly entire cystic fibrosis and its all the possible questions. Okay, so fataфат do mention your answer in the comment box. Which of the following is not a typical picture of the cystic fibrosis? Option A, recurrent lung infection. Option B, meconium ileus. Option C, pancreatic insufficiency. Option D, hypoglycemia. So what is the correct answer? What is the correct answer? Yes, beta. So what happens in the cystic fibrosis? It is in the problem of the CFTR gene. Okay, so there is the cystic fibrosis transmembrane regulator gene. Okay, so which gene? So that is the CFTR. Okay, so it is in the primary protein which is responsible for the like regulating the chloride and sodium, and along with that it will helps to makes the secretions thin, and which will helps to makes the secretions watery. So whenever there is a defect in the CFTR, there is the cystic fibrosis transmembrane regulator protein. Okay, so in that particular situations, the mucus, whatever the mucus which is producing, which will be very thick, which is very tenacious, and it is a very like hard in nature. Okay, so that particular thick mucus which will blocks the all the ducts. Okay, so which will block the all the exocrine gland ducts, it will block the all the respiratory respiratory routes, it will blocks. Okay, and it will block the our ileum also, the small intestine also. Okay, so very important, remember, due to the blockage of the respiratory vein pipes. Okay, so there will be a recurrent repeated infection will happens, because the secretion will keeps on accumulating, and secretion which will helps for the bacterial growth. Okay, every 15 days the patient will comes to the hospital with the complaints of the chest infection, shortness of the breath, and many more things related to the lung infection. Yes, the recurrent lung infection happens or not? Yes sir, it happens. Meconium ileus, the most earliest sign of the cystic fibrosis in infant, the most early sign of the cystic fibrosis in the infant, so that is the meconium ileus. Okay, so very important, do remember, it will also happens. Yes sir. Similarly, there is in the pancreatic duct. Okay, so there is in the pancreatic duct, so that duct also get blocked by the our mucus plug. Okay, so mucus plug is blocking the pancreatic duct, means the pancreatic enzymes, it will not comes to the duodenum. So that time there is no any enzymes for the digestion of the fat, protein, carbohydrate. Okay, so yes, it will causes the pancreatic insufficiency also. Very important, keep in your mind. And option D, yes, few of you have given the correct answer. Option D, hypoglycemia is not associated with the cystic fibrosis. In the cystic fibrosis, due to the pancreatic problem, there is deficiency of the insulin. Insulin is getting deficient, means yes, there is in the hyperglycemia we will evidence. Okay, there is not any hypoglycemia. Do remember the concept, very important. What is the problem in the cystic fibrosis? Yes, the problem in the CFTR protein. Okay, so that is the cystic fibrosis transmembrane regulator protein. Hope it is clear to everyone. Very important. Okay, so this protein is very much responsible for the chloride and the sodium exchange, and it is very much responsible for the making the what we can say the mucus, which how it's produced, which will maintains it in the thin nature. Okay, but CFTR's problem is, yes, there is no proper hydration of the cellular surface, and the chloride it will get trapped inside the cell only. The chloride is not coming outside the cell, means the mucus which is not having the capability to suck the water. Okay, so mucus is not sucking the water, means mucus becomes thick here, mucus become a tenacious here, mucus becomes the copious here. Okay, so very important, keep in your mind, the problem is in the CFTR protein, and it is having the function to change the sodium and chloride. Here it is problem is there, means so it will not change the chloride, and it is not maintaining the cellular surface hydration, so the mucus become thick here, and all the exocrine glands ducts are blocking here, so and blocks all the lumens of the body. Okay, so very importantly, I told the respiratory lumen is blocking, so that is the lungs, this is repeated. Ileum is blocking, the most earliest sign of the cystic fibrosis in the infants is the meconium ileus, and the pancreatic insufficiency due to the pancreatic duct blocking. Okay, so hope you are clear about this one, and hypoglycemia will not happen, hyperglycemia will happen. Okay, in the cystic fibrosis, it is in the ARD. Okay, what is the ARD, sir? Yes, is that acute respiratory disorder? No, but it is in the autosomal recessive disorder. Okay, so very important, CF is the ARD, remember. Yes, cystic fibrosis is the autosomal recessive disorder. It's not an X-linked disorder. It is in the autosomal recessive disorder. Okay, so it's in the chronic multi-system problem. It is not, there is no any problem. Only problem is not there in the respiratory. Only problem not there in the GI. The problem is there in the integumentary system. Okay, the problem is there in the respiratory system. The problem is there in the GI system. The problem is there in the male reproductive system, female reproductive system, everywhere. Okay, so it is in the multi-system problem. Remember the golden points. Okay, so what are the manifestation? It will comes on the GI problems. So this is the a question the examiner favorite. Okay, which will repeatedly strikes in the exam. The GI system manifestation, earliest manifestation in the newborn is the meconium ileus. Okay, so ileum. So the small intestine, the last part is the ileum. Yes, the small intestine having the how many parts? 3 parts. Which are, sir? duodenum, jejunum, ileum. So among these three, which one is the narrow one, sir? That is the ileum, sir. So which one the mucus which is producing, it will block the ileum, sir. Okay, so that is what you call the meconium ileus. Okay, so meconium which is mixed with the ileum, meconium which is mixed with the thick mucus, so which will block the ileus. Okay, so that will be what we call as in the earliest manifestation of the newborn, that is the meconium ileus. Okay, so very important, and it will causes the intestinal obstruction also. When there is in the small intestine or the large intestinal obstruction, that time the abdomen will be distended because the flatus or the stool which is not going out of the body. So flatus or the stool which is not going out of the body means the abdomen pain will be there, the nausea will be there, vomiting will be there, and abdomen will be distended. Yes, the how the abdomen of the cystic fibrosis baby will manifest, it is on the distended abdomen, it is the painful abdomen, and the repeated complaints of the nausea and vomiting. Yes, is that clear? Okay, so next in the GI system, it will block the biliary duct. Okay, so whenever it will block the biliary duct, you know, for the emulsification of the fat, the most important thing what we want is that is the bile juice. Okay, if we don't have the bile juice, fat will not get emulsified. If the fat is not getting emulsified, fat will not get digest. So whatever the fat we will have, it will go directly into the stool. Okay, so the stool will be very much rich in the fat. Okay, that is what you call the a stool with abundant fat. That is what we call the steatoria. What we call that one as in the steatoria. That is the stool with abundant fat. Okay, to remember. And if the stool which is having the very rich content of the fat means how the color of the stool, there is the clay colored stool. Okay, so do remember the other very important thing also here. The fat is not getting emulsified means yes, the fat will not absorb. Along with that, the fat soluble vitamins, that is the ADEK. Okay, so ADK or ADEK, whatever you can say. So these are the very important fat soluble vitamins. Yes, the how many fat soluble vitamins we have? That is the 4. Yes, how many water soluble vitamins you have? That is the yes, vitamin B and yes, vitamin C. Those are the water soluble vitamins, and ADEK. Okay, ADEK is the our fat soluble vitamins. So fat is not absorbing means fat soluble vitamins also will not absorb. So due to the deficiency of the vitamin K, the patient will or the child will start to bruise. Okay, easily. Whenever you will pinch the child like this, so that time the child will full scan will be like it's under the skin bleeding, you can see very easily. Okay, so the easily bruising or the easily bleeding will be there in the child with cystic fibrosis because due to the deficiency of the vitamin K. Yes, very important, sir. How the biliary duct obstruction which leads to all of these things. So please do remember the concept what I am explaining here because it is important to you all. Okay, so whatever the one-liner question I am explaining to every one of you now, it is golden points, it is important point, it is the concept, and it is the like base to create the scenario, and this thing which will strike in your mind while attempting the question, and the thing whatever I am explaining to you, it will help you to eliminate the option which are wrong in the exams. Okay, so please do understand the concept here. Okay, so first a largest gland inside the body, that is the liver. I am drawing that one. Okay, so liver, the largest gland which is there in our body is the liver. Okay, so this is the liver. Right lobe, left lobe of the liver, and from the right lobe of the liver, one duct will come, and from the left lobe of the liver, another duct will come. Okay, so this is the right hepatic duct. This one is the left hepatic duct. Okay, so it will comes like this. I am drawing the diagram of the biliary system and how the bile duct closure which leads to the stool which is protein color, and how which leads to the deficiency of the ADEK. The concept I am explaining because it is important, right? So we have the liver. This one is the right biliary duct, right hepatic duct and left hepatic duct. Okay, so this is the common hepatic duct, and here below the liver, every one of you know that we have the gallbladder. Okay, we have the gallbladder, right? So this from the liver, bile juice will produce. Okay, bile juice will be produced from the liver, and bile juice will be stored. Bile juice will be stored in the very important gallbladder. Okay, so this particular gallbladder. Okay, so this is the gallbladder, and this is the cystic duct. Okay, so all what we can say, the gallbladder duct we can say, and this one is the common bile duct. Okay, so this common bile duct, now it will comes and it will opens in the pancreatic duct. Okay, so it will opens in the pancreatic duct, and here we have the organ that is both works as the endocrine and the exocrine, that is the heterocrine gland. So that is our pancreas. Okay, so this is our pancreatic organ, right? Here we have the duodenum, the second part of the duodenum. So this is the first part of the duodenum, this is the second part, this is the third part of the duodenum, and here we have the third part of the duodenum. Remember beta, whenever the liver, it will secretes the bile juice. Bile juice will be produced by which organ? Bile juice will be produced by the liver, one important point. And bile juice will be stored in the which organ? Bile juice will be stored in the gallbladder. Okay, so bile juice will be transmitted by the common bile duct, and it will comes to the pancreas, and from the pancreas it will lands into the second part of the duodenum. Okay, so here we have the stomach above the duodenum, and whatever the food we have, so that food it will comes to the here duodenum, and here it will get a emulsification of the fat. Okay, after that the pancreatic will releases the pancreatic enzymes, so those enzymes it will breaks the fat. Okay, so very important, do remember this particular thing here. Okay, if in case in the cystic fibrosis, what happens? Due to the thickening of the mucus, it will block the bile duct. Bile duct is blocking. Okay, so bile duct is now blocked, means whatever the bile juice is producing, it will not comes to the our second part of the duodenum, and it will keeps on accumulating here. Okay, so keeps on accumulating here, and overload of the bile juice here, which will causes the biliary cirrhosis. Yes, it will causes the biliary liver cirrhosis. Remember, very important beta. Yes, if the bile duct is obstructing, means the bile is keep on accumulating in the hepatic duct, and it will keeps accumulating on the liver. Okay, so liver is full of the bile juice, and liver is have been started damaging, so that is the cirrhosis of the liver, which is due to the bile juice. Okay, that is what we call as the biliary cirrhosis. Very important point. Okay, so if the examiner is asking the most common type of cirrhosis, don't give answer as the biliary cirrhosis. Yes, the most common type of the cirrhosis is, fatapat do comment in the answer, which of the following which one is the most common type of the cirrhosis? Yes, that is the alcoholic cirrhosis. Okay, alcoholic liver cirrhosis is the most common type of the cirrhosis, right? So very important thing here, the bile is not coming now, means the fat which is came here for the emulsification and digestion, so this fat it will not get emulsify, and it will not get digest. So this fat will go like from the intestine, and it will comes in the stool. Okay, so the stool which is rich in the fat. Okay, so that is what we call the steatorrhea. Yes, in the cystic fibrosis, steatorrhea happens. Along with that, if there is any infection, inflammation in the this biliary tract. Okay, so that is in the, yes, what we call as in the infection, inflammation of the biliary tract. Yes, what is the cholecystitis? What is the cholecystitis? And what is the cholangitis? Well done, beta. Well done. Very good. Okay. So this is what a very important thing. I want active participation from you all. Okay. So here, if there is any obstruction due to the infection, inflammation in the common bile duct, again we will get the fat-rich stool. So that is the steatorrhea, and this stool color will be clay colored. Okay. So do remember the very important two word: clay colored stool, steatorrhea, which will be seen due to the biliary obstruction. If the obstruction is happening due to the cystic fibrosis mucus accumulation, so yes, in the cystic fibrosis also we will get the clay colored stool and the fat rich stool, that is the steatorrhea. Okay, so do remember the very important point. Okay, so and here the fat is not absorbing, means the fat soluble vitamin A, D, E, K will also will not get absorbed due to the deficiency of the like vitamin K. So there is easily bruising will be there. Okay, and that is the a very important concept you have to understand here. Hope it is clear to every one of you here. Okay, so next comes to the bile duct obstruction, which leads to the biliary cirrhosis. I told. Okay, so this biliary cirrhosis which will cause the portal hypertension, because in the biliary cirrhosis, yes, the liver is getting damaged. Okay, so that is the reason in the cystic fibrosis the portal hypertension also will happen. Okay, due to the cystic fibrosis, biliary cirrhosis also will happen. Okay, so very important concept. Then comes to the pancreatic duct blockage. Okay, so you know pancreatic, I told, if the biliary duct is blocking means, so that will causes the biliary cirrhosis and all. If the pancreatic duct, so this one is the pancreatic duct. If this duct is getting blocked means, yes, so that is what you call the pancreatic duct obstruction. So from the pancreas, there is the enzymes, what we call lipolytic enzymes, proteolytic enzymes, and the enzyme that is responsible for the digestion of the carbohydrates. So those enzymes, it will be get released by the pancreas. Here the pancreatic duct is blocking, so the enzyme it will get released, but it will not comes into the duodenum because the duct is blocked here. So what are the enzymes it will be get released by the pancreas? So quickly let me revise the revision. Okay, so you know pancreatic enzymes, normally the proteolytic enzymes. So yes, the trypsin and the chymotrypsins are the two very important enzyme. It will be released by the pancreas to digest the protein. Okay, so it will be helpful for the digestion of the protein. Okay, so if the cystic fibrosis which is blocking the pancreatic duct, so there is no any digestion of the protein. Okay, no digestion of the protein, the patient will be having the less protein in the blood. So that is what you call as in the less protein. That is the main abundant plasma protein is the albumin. So the albumin is getting deficit here, so hypoalbuminemia is there. You know the main protein which is responsible for the maintaining the oncotic pressure of the blood is the our albumin. Here the albumin is deficient. So why albumin is deficient? Pancreatic duct have been blocked, means proteolytic enzyme is not working, means the protein is not digesting. Protein is not digesting means protein will not absorb. Protein will not absorb means the patient of the cystic fibrosis will feel the hypoalbuminemia. Okay, so hypoalbuminemia is there. So that is the reason here there is no any protein inside the blood vessel to keep the fluid inside the blood vessels. Okay, it will leaks the fluid. Okay, so yes, so consider this is the blood vessel, and inside the blood vessel, so there is the albumin is there. Okay, so this albumin it will sucks the fluid inside the blood vessel. If the albumin is not there means it will leads to the leakage of the fluid outside the blood vessel, and the fluid it will get accumulates in the interstitial space. So this is what you call as in the very important edema. Okay, accumulation of the fluid inside the entire interstitial space. So that is what you call as the edema. If hypoalbuminemia is there, so there is no albumin inside the blood vessel, so there is no oncotic pressure. What is oncotic pressure? Pulling pressure. So there is no pulling pressure. Okay, so there is no any fluid there is no any fluid pulling is there. So fluid will keep on leaking. So which means leads to the edema, and which means leads to the anasarca. Sir, what is anasarca? So fatapat, do mention your answer in the comment box. What is anasarca, beta? Yes. What is anasarca? My question is simple. Yes, that is the very nice of you all. That is the full body edema. That is what you call as the anasarca. If your entire body is getting fully edematous, so that is what you call as the anasarca. Okay, so we may experience the anasarca also due to the deficiency of the albumin. Okay, so golden point, remember the plasma protein which is mainly responsible for the maintaining the plasma oncotic pressure is the albumin. If the albumin is low, risk of the edema is high. Very important golden point, remember. Okay, so due to the pancreatic duct blockage, I told there is no proteolytic enzyme, there is no protein digestion, there is no protein absorption. No protein absorption means less protein in the blood, so less albumin in the blood, so hypoalbuminemia will happen, and in the cystic fibrosis the body will get edematous. Okay, hope it is clear, and hope it is very much clear to every one of you, right? Next, the simple second organ enzyme we have here is the lipolytic enzyme. Lipo means lipid, lytic means breaking, means a enzyme which is responsible for the breaking the fat. Okay, so that is the lipolytic enzyme. What we have is the pancreatic lipase. Okay, so in the pancreatic lipase, this is responsible for the digestion of the fat here. Okay, so this fat is like due to the obstruction in the pancreatic duct. Pancreatic lipase will not comes to the duodenum. There is no entry of the lipase into the duodenum, means there is no lipid digestion. So the patient will be having the clay colored stool. So that is the stool which is rich in the fat. Okay, so that looks like a clay in color. Okay, so then comes to the steatoria. Okay, so that is the fat rich stool. Hope it is clear. Then the pancreatic amylase. So this is the enzyme which is responsible for the digestion of the carbohydrate. If there is no any carbohydrate digestion, means the patient will feel the low energy and recurrently patient will require the rest here. Okay, yes, let me quickly revise the golden points better. Which enzyme is responsible for the digestion of the fat which is released from the pancreas? So that is the option A, trypsin, chymotrypsin, amylase, lipase. So what is our answer? Which enzyme is responsible for the releasing of the digestion of the fat which releases by the pancreas? Well done, beta. That is the lipase. Lipase is the enzyme which is responsible for the digestion of the fat. Okay, so which all are the two very important enzymes which releases from the pancreas and which are responsible for the digestion of the protein? So that is the trypsin, chymotrypsin. Yes, so very important, right? So from the mouth also we will release the amylase. From the pancreas also we will release the amylase. Okay, so whatever the amylase which is releasing from the mouth, so that is what we call as, yes, salivary amylase. Okay, so that another name of the salivary amylase is the ptyline. Okay, so ptyline. So ptyline. Okay, so ptyline is the amylase which releases from the salivary secretion and the carbohydrate digestion will start from the mouth. Okay, and the pancreatic also one enzyme which is responsible for the carbohydrate digestion, that is what we call as the pancreatic amylase. Okay, so hope it is the pancreatic enzymes are clear here. And so why edema will happen, clay color stool will happen, steatoria will happen, and the low energy will feel in the particular what we can say in cystic fibrosis. Hope it is clear to every one of you, right? So here is the next question. Next concept on the cystic fibrosis. Just you have to remember, beta, the pancreatic enzymes are deficient here, which are responsible for the fat, protein, and the carbohydrate digestion. You know, the fat, protein, and carbohydrates are the very essential part for the normal living organism or the normal living person. If there is in the deficiency of the pancreatic enzyme, we need to give that pancreatic enzyme, that is every time, every day, and the lifetime. Remember, every time means every time the patient will have the food, that time the patient requires the pancreatic enzyme. Okay, he is having the morning breakfast. Okay, so the lunch, dinner, and the snacks. Every time he will have the food, every time he have to take the pancreatic enzyme. One thing, do remember. And the pancreatic enzyme, whatever the tablet form we are giving, so that one will be given for the lifetime. Okay, not for the 1 day, 2 days, 3 days, 5 days. Because we require the digestion for the lifetime, we require the protein, fat, and carbohydrates for the lifetime until our last breath will be there. Till that time, we require the protein, we require the fat, we require the carbohydrate. So that is the, for the digestion of the all these things is very necessary. So I want the pancreatic enzyme to be given entire lifetime. Okay, so along with this, what very important thing we need to monitor in the patient who is taking the pancreatic enzyme is, we need to monitor the growth of the patient, especially weight of the patient. Why? Because if the patient is taking excessive pancreatic enzyme, that time there is excessive fat digestion, excessive protein digestion, excessive carbohydrate digestion will be there, and excessive fat absorption, protein absorption, and carbohydrate absorption is there. So whenever there is excessive protein and fat, it will increases in the body, so weight gain will happen. Okay, so patient may become obese very easily. So in order to prevent that, every time the patient comes to hospital, we need to monitor the weight and we will record the weight, and we will advise the pancreatic enzyme based on the patient growth and development. Okay, so that's the very important. Usually this patient will be like cystic fibrosis will be diagnosed in the childhood life only. Okay, so enzyme should be taken with all the meals and snacks. And for the infant children who can't swallow the capsules, so we can mix the capsules with the we can open the capsules and mix with the acidic soft food like applauses. We can mix and we can give to the patient. Okay, so very important. Remember, so in the pancreatic, due to the pancreatic duct obstruction, so whatever the lipase, whatever the protein trypsin, chymotrypsin which is releasing, which is not coming out, and which is keeps on accumulating in the pancreas. So that is the reason the pancreatic fibrosis will also happens in the cystic fibrosis. Due to the pancreatic fibrosis, the beta isolate cell will get damages. So insulin will get decreases. So blood glucose will get increases. So that is the reason in the question number 1. So I told which of the following is not typical feature of the cystic fibrosis. So that is the not a typical feature of the cystic fibrosis. That is the very important one. A hypoglycemia is not a typical feature of the cystic fibrosis. Yes, what all are the things we have studied here? Let's quickly take a single 3 minutes and revise the entire 25 to 30 golden points for you. Okay. So problem in the cystic fibrosis, there is the cystic fibrosis transmembrane regulator gene, which electrolyte mainly affects the chloride and secondarily sodium. Okay, so what is the problem here? There will be a thick mucus which will accumulate and block all the exocrine gland. Okay, so the earliest manifestation in the newborn of the cystic fibrosis is the meconium ileus. Intestinal obstruction leads to a baby will manifest with a pain in abdomen, nausea, vomiting, abdominal distension. And black in the biliary system, it leads to the clay colored stool, and the fat rich like frothy foul smelling stool will come. Okay, so the steatorrhea we will call that one, right? So due to the less absorption of the fat soluble vitamin A, D, E, K deficiency will be there, the patient will bleed easily early. Okay, so due to the bile duct obstruction, there is a biliary cirrhosis will be there, and portal hypertension also will be there in the cystic fibrosis. Due to the pancreatic duct obstruction, there is in the edema will be there due to the less protein absorption, and clay colored stool steatorrhea will be there, and due to the less absorption of the what we can say carbohydrate, there is low energy also will be there. Okay, and the enzymes which is responsible for the digestion of the protein is the trypsin, chymotrypsin, and the enzyme responsible for the digestion of the lipid is the lipase, and the enzyme digestion responsible for the digestion of the carbohydrate is the pancreatic amylase. Very very important, right? So here we will educate the patient for the pancreatic enzyme replacement lifetime, and the most important thing what to monitor, we need to monitor the growth and the weight of the baby. Very important. Okay, so if the baby is not taking the pancreatic enzyme, we can open the capsule and mix with the acidic foods. So that is example like applauses. Okay, in that one we can mix. So here the pancreatic fibrosis will happens, and beta isolate cell of the Langerhans will get damaged. So beta cells of the pancreas is damaging means from there only insulin will produces. So the cells are damaged means no insulin production. So the blood glucose level will increases. Okay, so that is the very important thing which happens in the cystic fibrosis, that is related to the GI system. Comes to the respiratory system, I told the mucus in the respiratory system very thick. Okay, and repeated respiratory infection will happens. If examiner asking the most common cause of the death in the cystic fibrosis, so that is the respiratory failure due to the recurrent infection and the blockage of the respiratory small bronchioles level complete blockage by the thick mucus. So that is the very very important. Respiratory failure is the most common cause of the death in the cystic fibrosis. Okay, so in the integumentary system changes in the cystic fibrosis, your last Norcet question. So there is the integumentary system changes in the cystic fibrosis. That is the salty skin is the hallmark sign of the cystic fibrosis. Whenever the mummy will kiss the baby, so mummy will complain, my baby is very salty. Doctor Z, my baby is very salty. Why? Because in the sweat there is access to release of the sodium and chloride will be there. So that especially due to the sodium and chloride excess release in the sweat, so which means leads to the salty baby. Okay, so that is the classical description the mother will tell to the in the history of the patient with cystic fibrosis. Okay, so this is our last Norcet question. Integumentary system related complaints. This is the Norcet question. Okay, sweat chloride test, Norcet 8 question again. Very important. Then the sweat chloride test. So let me quickly revise the sweat chloride test because it is important, right? Better. So how we will do the sweat chloride test and how we will interpret the sweat chloride test. First, remember, sweat chloride test will be done in a case of the cystic fibrosis. In case of the cystic fibrosis, do remember the very important thing. Sir, how we have to do this one? First, what is the normal sweat chloride level, sir? Normal sweat chloride level is less than 40 millimole per liter is the normal sweat chloride level. Okay, sir, how we have to do the sweat chloride test, sir? So we will give the cholinergic drug called as the pilocarpine. So this pilocarpine is the cholinergic drugs which will increase the a parasympathetic nervous system. So that time the sweat production will be increased. Okay, so sweat production will be increased. So we will collect the 75 mg of the sweat. Sir, how much mg of the sweat we will collect, sir? Sir, we will collect the 75 mg of the sweat we will collect, sir, and I will send that particular sweat to the lab. Okay, so or the lab technician itself, he will comes to the ward and he will, like with the help of the doctor, he will administer the pilocarpine and he will collect the sweat and he will take to the lab. Okay, so the sweat chloride level which is coming 40 to 60 millimole, so that it indicating there may be a chance of the cystic fibrosis. So we will repeat the test. If the sweat chloride is less than 40, that is the normal thing, no any case of the cystic fibrosis. Okay, if the sweat chloride is 40 to 60, there is suspiciousness of the cystic fibrosis, we need to repeat the test. If the sweat chloride level which is coming more than 60 millimole per liter, so this is the positive sweat chloride test, and it is the very important thing that may strikes in your exam. Okay, sir, how much chloride which is available in the sweat, we can say that one is in the positive sweat chloride test. If the chloride level more than 60, sir, that time we will do the confirmation of the patient is suffering with the cystic fibrosis, right? So along with that, the sweat chloride which is amount of the 40 to 60 millimole. So what we have to do, sir, we need to repeat the particular sweat chloride test. Okay, sir, in the cystic fibrosis, I told due to the deficiency of the lipase enzyme, so there is no lipid digestion, lipid absorption, means the lipid soluble vitamins also will get less absorption. Okay, so all the vitamins like A, D, E, K, so which all are the important lipids, water like fat soluble vitamins are there. So all the fat soluble vitamins externally we have to do the supplementation. Okay, so pancreatic enzymes we need to replace, and daily chest physiotherapy we need to advise. Okay, why? Because in the respiration there is thick accumulation is there, so thick mucus accumulation is there. In order to get it outside, so we will advise for the chest physiotherapy. Okay, so there is in the chest physiotherapy will be advised. Okay, so here the patient will be undergoing for the percussion vibration. Okay, so and the cup method, tapping of the chest will be there, so which makes the accumulated mucus to get released from the particular site of the accumulation. Okay, after that we will do the postural drainage. Okay, so we will give the different position, okay, to remove the particular secretion out. Okay, so early in the morning we will advise for the, so when to do this particular cystic chest physiotherapy. Chest physiotherapy will be done early in the morning, okay, after awakening, or in the evening we need to do. And never ever do the cystic fibrosis, never ever do the chest physiotherapy. Okay, so in the just before the meal, don't do the chest physiotherapy, and immediately after the meal, don't do the chest physiotherapy. When it will be recommended, it will be recommended early in the morning and in the evening. Okay, so do remember the very important one. Okay, so hope the many questions we have discussed here in the one particular disease condition, all the questions and all the applied questions and necessary scenario points, everything we have finished in the cystic fibrosis. Let's come to the point of the discussion. Next question is here. So please do read the question, okay, and try to mention the correct answer in the comment box. Yes, beta, fatafat. Do read the question and try to mention the correct answer in the comment box. Which of the following is considered as in the protective factor for the seeds? Sir, what is the seeds? Seeds is the, what is the seeds? Seeds is the very important condition where a normal baby, okay, so normal baby, apparently normal baby, it will suddenly get die. Okay, so that is what you call the seed. So that is the sudden infant death syndrome. Okay, so normal baby which had the normal breastfeeding from the mother, okay, which had the normal food and it slept on the bed. Okay, so morning we are seeing the baby is died. Okay, so that is what you call the sudden infant death syndrome. Which of the following is considered for the protective factor against the seeds? Means it is reducing the incidence of the seeds. Option A, formula feeding. Beta, formula feeding increases the risk of the seeds. Maternal smoking. Okay, if the mother is smoker or the father is smoker, and if the baby is sharing the bed with any kind of smoker, which will increase the risk of the seeds. Okay, and overheating of the infants. If you are overheating the infants, yes, this is also will causes the sudden infant death syndrome. And you are keeping the specifier. If you are keeping the specifier in the mouth of the baby during the sleep, okay, so it will not block the baby's respiratory tract. Okay, so baby's respiratory tract is not blocking means the baby will not get die. Okay, so the pacifier used during the sleep, which will be a considered as a protective factor against the SIDS here. Okay, so very important, keep in your mind what is SIDS. SIDS is the sudden infant death syndrome. Okay, what happens here in the SIDS, there is suddenly unexplained death of the seemingly or the apparently healthy baby, okay, under the 1 year of the age. Usually during the sleep it will happens. Okay, sir, why, sir? Why? Because if the mother is using the very soft bed, okay, and now baby is sleeping on this one, okay, consider the baby is in the prone position. So this, due to this bed softness, the face may go inside and the respiratory tract may get blocked. Okay, so due to this soft bed using, the baby respiratory tract will get blocked and the baby will die till the morning. Okay, so very important. Along with this, if the mother is using the very soft blanket, okay, so soft blanket, she's covering the baby completely, so this soft blanket may block the respiratory tract of the baby may get die. Okay, so another thing, now just the baby have the breastfeeding, okay, suddenly mother have given the prone position to the baby, so again it will cause the aspiration and it will cause the aspiration and the blockage of the airway due to the regurgitation of the fluid. Okay, so that again, the prone position immediately after the feeding, the prone position immediately after the feeding will increase the risk of the SIDS. Okay, so don't give the prone position immediately after the feeding, don't use the soft blanket, don't use the soft bedding, and don't share the bed of the baby with the smoker, even if it is the father, even it is the mother. Okay, so if the mother also smoker, please be away from the baby while sleeping. Father also smoker, please be away from the baby while sleeping. Okay, so otherwise you can quit the smoking, that is the best one. Okay, so most common age group of the SIDS is the 2 to 4 month. Okay, so usually happens less than 1 year baby, and the highest incidence which happens during the 2 to 4 month of the age. Okay, so more common in the boys, it will be more common in the boys, and usually which happens during the night. Okay, so that is the most important thing. Then the most common risk factor is the prone position. Remember, just now the mother have given the feeding and she given the prone position to the baby. Okay, so which will increase the risk of the sudden infant death syndrome, that is the SIDS. So always keep on remembering, don't give the prone position to the baby immediately after the feeding, because it increases the risk of the sudden infant death syndrome, that is the SIDS risk will be increased. Okay, so and the soft bedding, I told, soft pillow and the loose blanket which blocks the airway and baby may get land into the death, and maternal smoking during the pregnancy and the maternal smoking, paternal smoking after the baby birth. Okay, so the smoker sharing the bed with the patient. Okay, that is also increases the risk of the what we can say SIDS. Okay, and overheating during the sleep also increases the risk of the sudden infant death syndrome. And bed sharing, okay, so that is the especially with the smoker, okay, or the tired parents, so they will consider the baby or the as in the pillow and they will take the baby and they will keep like this. Okay, so it may lead to the death of the baby. Okay, so don't share the bed with the especially smoker daddy and the tired parents. Okay, so that is the a very important most common risk factor of the SIDS. Among all the most common is the prone position after the feeding. Okay, so very important. And protective factor, give the supine position or the frequently breastfeed, and don't give the prone position, only breastfeeding. Okay, and the pacifier we are keeping in the mouth of the baby, okay, which maintains the patency of the baby, even if it is in the prone position, even if it is in the any position, even the baby is in the soft pillow, soft bedding, loose blanket, still it will keep the airway open. So that is the pacifier use, means we will keep on pacifier in the mouth of the baby, so it will protect the airway. Okay, so then the room sharing, without you can share the room with the baby, but you don't share the bed with the baby. Okay, so very important. And there was one campaign previously in order to reduce the incidence of the SIDS. Okay, so there was a health education campaign where the every taluka level, every community health level, so there was a campaign, there is the back to sleep campaign. So back to sleep campaign was run by the government of India in order to reduce the incidence of this SIDS. Okay, so now previously that was the back to sleep, now updated thing, remember. So now we have the safe to sleep campaign. Okay, safe to sleep campaign, safe to sleep campaign, it will be again run by the government of India to decrease the incidence of Sudden infant death syndrome. Okay, so do remember this one, very very important one. Okay, yes. So now comes to the next question. Which of the following is not an obstructive lung disease? Yes, the next question is awaiting your brilliant answer in the comment box. So please do comment your answer here. Which of the following is not an obstructive lung disease? Option A, emphysema. Option B, chronic bronchitis. Option C, pulmonary fibrosis. And option D, bronchiectasis. So which of the following is in the not an obstructive lung disease? So please do remember, obstructive lung disease means there is in the a problem in the air entry and air exhalation. Okay, a restrictive lung disease means there is a problem in the expansion of the lung. Okay, so lungs are not expanding means there is in the restrictive lung disease. Air is not entering inside the lungs means there is in the obstructive lung disease. So in the obstructive lung disease we will study the COPD, that is the chronic obstructive pulmonary disease. Okay, so what is the COPD? COPD is the chronic obstructive pulmonary disease. In that one we will study the emphysema, we will study the chronic bronchitis, and we will study the bronchiectasis also, plus or minus. Okay, so the main important two are the emphysema, chronic bronchitis. Okay, so very very important here. The emphysema is the a very important condition which happens due to the repeated smoking, and due to the smoking there is in the damage to the elasticity of the particular lung. Okay, so the elasticity of the our SNS elasticity of the our alveoli get lost, and whatever the air it will go inside, it will get trapped inside only. Okay, and it will not exhale the air properly, so that it will create the obstruction there. Okay, so that is in the emphysema. And the chronic bronchitis, again there is in the chronic inflammation in the airway, so air entry is difficult, right? In the bronchiectasis, so if any mucus is get accumulated, okay, if any mucus is get accumulated, so distal to the mucus accumulation, this particular, consider this is in the bronchioles. Okay, so this is the distal part of the bronchioles. So is this particular distal part of the obstruction which is getting abnormally dilated. Okay, so this is getting abnormally dilated, so that is what you call the bronchiectasis. Ectasis means abnormal dilation. Okay, so there is in the abnormal dilation distal to obstruction. Distal to obstruction. So this is also in the obstructive disease. Okay, so very very important, keep in your mind. And the pulmonary fibrosis, so this is not in the obstructive, this is in the restrictive lung disease. Okay, so this one is the restrictive lung disease, very very important, keep in your mind. Okay, so these are the list of the obstructive lung disease here. The asthma is the acute airway inflammation, and which happens due to the release of the some inflammatory mediators at the airway will get constrict. Okay, so there will be a obstruction in the airway. So asthma, which is reversible, okay, whenever we will treat it, it will comes to the normal position, so it is reversible. And previously asthma is also part of the COPD. Now we will study asthma separate, we will not include the asthma in the COPD. Okay, so next, chronic bronchitis, emphysema is a part of the our COPD. There is the chronic obstructive pulmonary disease, and bronchiectasis also, plus or minus, we will study under the COPD only. Okay, so that is very important. Then comes to the restrictive lung disease. Here the pulmonary fibrosis, which happens due to the side effect of the drugs called as the amiodarone. Amiodarone is the drug which is having the highest incidence and the side effect of causing the pulmonary fibrosis. Okay, so another drug like methotrexate. Okay, so this amiodarone, methotrexate are the drugs which will cause the pulmonary fibrosis. Okay, so it will not allow the lungs to completely expand. Then the interstitial lung disease. Okay, so sarcoidosis, pneumoconiasis, and the pleural diseases like pleural effusion, it will also not allow the lungs to completely expand the lungs. Okay, then the hemothorax and the pneumothorax. So these are the lung disease where it will not allow the lungs to completely expand. Okay, so these are called as the restrictive lung disease. We will study many other lung diseases are there under the restrictive lung disease. Just I have taken the important thing only. Okay, so here is the next question in front of you all. So please do read the question carefully, completely, and try to give the best answer in this particular scenario. Yes. Fatapat do mention your answer better. So I'm waiting for your response here. So just we are holding the one question and we are dealing with all the possible questions. So that is necessary for our exam. So this is how we have to study near the exams. Okay. So just not only focusing on the important things. Okay. So important points, that is even minor one. So that decides the ranks. Okay. So just I am keep on revising the all the important points for you all, because it strikes in the exam and it will help you to solve the question, and even if it is not directly comes, indirectly it will help you to eliminate the wrong option. Yes, that is how we will go near the selection and we will go top of the selection list. Okay, so yes, to please remember and do mention the correct answer. Well done, but almost all people given the correct answer for this question. A patient with asthma is prescribed both salbutamol and the budesonide inhaler. What is the correct nursing instruction we have to give here? Okay, so yes, option M, take both inhaler at the same time. Better, how we can take the both inhaler at the same time? It is not possible. Okay, so take the budesonide first. Budesonide is the steroid, so we are taking the first, and airway is obstructed, we are taking the budesonide, that is the steroid. It will not enter the airway only. Okay, so don't we give the budesonide first. Okay, so always give the bronchodilator first, so that it will dilate the bronchi, then give the steroid, it will go inside the airway and it will reduce the inflammation. Okay, so very important in the asthma patient. Okay, so both salbutamol and budesonide both are prescribed. Okay, salbutamol is the SABA, that is the short acting beta agonist drug. So it will stimulate the beta receptor, and the beta receptor is responsible for the dilation of the airway. Okay, so remember, so SABA, that is the beta agonist or the short acting beta agonist. We will study the two very important drugs, and the clinically mostly used drug of the SABA, that is the albuterol and the salbutamol. Okay, so salbutamol and albuterol, so very important two drugs we will study under the SABA, and these SABA are the very important for the dilation of the bronchi. Okay, after dilation of the bronchi, I will give the steroid. So steroid will go inside the airway completely and it will reduce the inflammation. Okay, yes, and the budesonide is the steroid here. Okay, so this one is the steroid. Okay, so that time first take the salbutamol, that is the beta blocker, sorry, beta agonist, then wait for the 5 minutes, then I will give the budesonide. Why I have to wait for the 5 minutes? I have to wait for the 5 minutes for the bronchodilation. Okay, so very importantly, right? So the next nursing instructions in the patient with asthma, so that is the bronchodilator and steroid together prescribed, means just first we have to give the bronchodilator, we have to give the first, then we have to wait for the duration of the 5 minutes, and last we have to give the steroid. Okay, so after the waiting for the 5 minutes, we will give the steroid. Very important. And the two same drugs are prescribed, like consider two steroids are prescribed. Okay, so that time what we have to do? First dose we have to give, just wait for the 1 to 2 minutes, then give the second dose. Okay, if the two same drugs are prescribed, try to give, maintain the time duration of the 1 to 2 minute gap. And if the two different drugs like bronchodilator and steroids are prescribed, so first give the bronchodilator, wait for the 5 minutes, and give the steroids. Okay, this is the how the nursing instruction we need to advise to the patient. Okay, so one more important thing, if you are advising the patient to use steroid as an inhaler, that time every time the patient will inhale the steroid, that time we will advise the patient to go for the washing of the mouth. Okay, so why? Because this steroid is the immunosuppressive thing. So patient is inhaling the steroid, means yes, there is accumulation of the steroid in the mouth, and in the nasal cavity also will accumulate. Okay, especially in the mouth the steroid is accumulating, means it will reduce the immune function of the mouth, and it will increase the risk of the oral infections, especially the oral candidiasis. You know, the candidiasis, wherever the immunity comes to the down, and that time the candidiasis will increase. Okay, so that is the reason, in order to avoid the oral candidiasis and other oral opportunistic infection, so every time whenever the patient uses the steroid inhaler, so that time the patient should wash the mouth. So this is our clear instruction as a nursing officer you have to give to the patient. Okay, so very important instruction you have to give to the patient. Okay, so then comes to the golden points on the asthma. Beta, asthma is then the chronic inflammatory disease of the airway, which is characterized by the, means it is not in the 1 day 2 days condition. It will be for some people it will be lifetime. Okay, for some people it will get decreases as age increases, the asthma will get decreases. Okay, so do remember, asthma is in the reversible airway obstruction. Why? Because whenever there is a airway obstruction, okay, so that time the FEV1, that is the forced expiratory volume in 1 second, so it will get reduces. Okay, it will get reduces less than 70%. Okay, so whenever I will give the bronchodilator, that time it will again comes to the normal. Okay, so that is the thing I told. The asthma is in the reversible obstruction, and it is in the airway hypersensitivity reaction, means some allergies. If the airway is obstructing to some allergies, some dust, okay, so that time the airway inflammation will start. Okay, so that is what you call the hypersensitivity reaction or allergic reaction of the airway. Okay, so here the mucus also overproducing because of the exposure to the allergies. Okay, so asthma causes are the two types: extrinsic, intrinsic. Extrinsic means outside causes. Okay, so that is on the due to the external allergy. Okay, so asthma is happening due to the external allergy, so that is what you call the extrinsic. Okay, so here the allergy is happening means, yes, which immunoglobulin will increase in the allergy? That is the immunoglobulin E is the very abundant and dominant immunoglobulin which will increase in the case of the allergy. Okay, so in the asthma also IgE increased, and the histamine as an inflammatory mediator, it will get increases in the extrinsic. Okay, and this extrinsic means due to the external allergy, like pollen grains allergy, like a household dust allergy, like a allergy to the perfumes and other things. Okay, so where due to the allergy which happening means IgE and histamine will rises, and this allergic and extrinsic asthma, it will, as the age increases, the incidence of the asthma and the reoccurrence of the asthma and the asthma will comes to the normal. Okay, so recovery happens with the age in the extrinsic cause. If the patient is having the intrinsic cause, like due to the genetic causes or due to the other lung disease, due to the other lung disease conditions, so where the asthma is happening due to the intrinsic, the genetic causes and the other lung diseases, due not happening due to the allergies. Okay, so no allergy means the IgE is normal in the intrinsic asthma, and histamine also will be normal in the intrinsic asthma. Only in the allergic asthma the IgE and histamine will rises. Okay, and this intrinsic asthma increases with age. Okay, very important, do remember, as the age increases, the asthma incidence will worsens. Okay, so that is a very important thing, just try to keep in your mind. Okay, so diagnosis of the asthma, the PEEP, that is the peak expiratory flow rate, it will decrease because of the airway obstruction. Whenever the patient will try to exhale the air, so it will be he is unable to exhale the air completely. Okay, so that is the peak will like what we can say, the P. Okay, so that's the peak expiratory flow rate, it will get decreases. And the spirometry in the pulmonary function test, in the spirometry test, what we can say are the pulmonary function test in the asthma, the FEV1, that is the forced expiratory volume in 1 second. Okay, so like this, in 1 second, how I am exhaling the air in 1 second, so that is also will get decreases because of the airway obstruction. Okay, and the functional vital capacity, it may rises or it may remains same, and the ratio will be less than 70%. Okay, the patient is unable to exhale the more than 70% air here in the asthma. Okay, so I told FEV1 will decreases whenever I will give the bronchodilator, it will comes to the normal. Okay, or FEV1 will 12% increases, means 70 plus 12, 82%, means that is on the normal FEV1. Okay, so it will coming to the normal, so it will be a reversible condition, I told. Okay, so most common like triggering factor for asthma is the household dust, remember, and all the triggering factors are the allergens, that may be due to the pets, or that may be due to the pollen grain exposure, and that may be due to the dust exposure. Okay, and the viral infections which will cause the trigger of the asthma, and exercises, cold air, smoking, stress, which will increase the risk of the asthma. And NSAIDs, drugs, what you call as the NSAIDs, special aspirin, is increases the risk of the asthma. And in the asthma patient, all NSAIDs are contraindicated. Why the NSAIDs are contraindicated in asthma? Very important. Why the NSAID are contraindicated in the asthma? That is the non-steroidal anti-inflammatory drugs. Okay, so this NSAID works by inhibiting the COX function. Okay, so whenever it will inhibit the COX function, it will stimulate the LOX. Okay, so COX is inhibited means it will stimulate the LOX. Okay, so due to the stimulation of the LOX, there is the increased leukotrienes. Leukotrienes are the inflammatory mediators, and which will cause the inflammation of the airway. Okay, so that is the reason NSAIDs, especially aspirin, is contraindicated in the asthma. Beta, it is a very important thing. Okay, so then other than this, beta blockers are also contraindicated in asthma. Okay, beta blockers also contraindicated in asthma. Very important. Like all the lols. Okay, so lols also contraindicated in asthma. Why? Because these beta blockers will cause the blockage of, or it will cause the blockage of airway. Okay, or we can say it will cause the bronchoconstriction, we can say. Okay, beta agonist will cause the bronchodilation and beta blockers will cause the bronchoconstrictions. So all the beta blockers should be contraindicated in case of the asthma. Sir, hope whatever the thing we have explained here is very much clear to every one of you, and I am giving some special assignment question to every one of you. So please do mention your answer in the comment box at the end of the video. Okay, sir. Case of cystic fibrosis, taste of the skin. So which taste of the skin you will get in the case of the cystic fibrosis? Very important. Normal sweat chloride level, how much? Normal sweat chloride level, how much? So please do mention your answer in the comment box. Okay, sir. Sudden infant death syndrome happens due to which position after feeding? After the feeding. So these are your very important questions for your assignment. So please do mention your comment in the assignment. So if possible, tomorrow I will hit the 3 more classes in one day, because I want to cover all the important points. So because I promised to you people, so whatever the possible thing is there from my side, I will give. So please be ready to hit all the golden points, and the concept is most important than the questions. So I am explaining the concept. It will take little 20 to 25 minutes more time, and it will be valid for your exam. Believe me, your master is with you, and your master is here to get selection for you all. Okay, so hope everyone enjoyed the today's session. We will meet again in the tomorrow session. Thank you so much for watching the class. Bye bye, take care, love you all.